When you drive a school bus loaded with children, you're responsible for their lives. In fact, you have one of the most important jobs anyone could have. In addition to staying safe on the road, you have the job of keeping yourself, your students, even your family safe from blood-borne diseases like HIV and hepatitis. According to the Centers for Disease Control, millions of people may be walking around with HIV and hepatitis without knowing it. And children get these blood-borne diseases just as often as adults. They feel normal and have no symptoms, but they're contagious and can spread these viruses to others. In this program, you'll learn why, as a bus driver, infection control is one of your most important responsibilities. You'll learn how HIV and hepatitis are spread and how to reduce the risk of infection by these and other blood-borne pathogens. You'll also learn how and when to use personal protective equipment to make sure you're protected. To this driver, the idea of putting on a pair of gloves before helping a student would have seemed silly a few years ago. Not anymore. These days, with deadly viruses on the rise, infection control is more important than ever. People can harbor all kinds of dangerous blood-borne pathogens and never know it. Tiny blood bugs, too small to see with the naked eye, could cause big trouble. They're present in blood and body fluids with visible blood. To infect you, they need to get inside your body, for instance through your mucous membranes or a break in your skin. The ones that put you at the greatest risk on the job are HIV, human immunodeficiency virus, HBV, hepatitis B virus, and HCV, hepatitis C virus. HIV attacks the body's immune system and destroys its ability to fight infection. A person or a child infected with HIV may simply carry the virus and appear healthy for many years. Although many persons infected with HIV will go on to develop AIDS, the rate is declining due to new drug treatments. Unfortunately, there is still no effective vaccine to prevent AIDS and no cure. Hepatitis B and C attack the liver and are easier to get than HIV. In most cases, people infected with hepatitis B get over the infection within 6 months, but some never do. Their infection can eventually lead to chronic liver disease or liver cancer, even death. The good news is a vaccine is available to protect you from ever getting hepatitis B. Hepatitis C is more dangerous. 75% of people show no signs or symptoms of the virus when they're infected. 85% will develop chronic liver disease. Remember that people can carry these viruses for many years without showing symptoms, but are still contagious. So it's important to treat all blood as if it could be infected with blood-borne pathogens. HIV, hepatitis B, and hepatitis C are spread through contact with blood, semen, vaginal secretions, and any other body fluid or tissue that contains visible blood. They can also be passed from pregnant women to their newborn children. But they're not like colds or the flu. For you to get infected, these body fluids from infected people have to get inside your body and into your bloodstream. How? The most common ways are through sexual contact and sharing needles to inject drugs. But what about on the job? You can cut yourself on glass, metal, or anything that has been contaminated with blood or infected body fluids. Or blood or body fluids can splash into your eyes, up your nose, or into your mouth. Or a cut or break in your skin can come in contact with blood or body fluids from an infected person. As a school bus driver, you have plenty of opportunity for infection. After all, wherever there are kids, there can be cuts, scrapes, and nosebleeds